Hello, my name is Brigell, and I graduated from the University of Michigan in 2012 with a degree in psychology honors. Now I'm a clinical research coordinator in the Department of Radiation Oncology at Brigham and Women's Hospital in Boston, and I will also be starting medical school in the fall. I chose to major in psychology because when I got to Michigan, I wasn't really sure what I wanted to do, but I knew that I loved working with people, especially kids, and I also knew that I would like to get involved with research. And so I took Psych 101 and I really loved it and decided that psychology was the major for me. It's been a huge help in everything that I've done thus far in my career. So I've worked in public health and now I work in clinical research, and throughout everything I've done, I feel like the basis of research knowledge and research skills, as well as the way that psychology really taught you how to understand people and maybe the motivations behind people's actions, I think that's been very helpful for me so far in my career. So after I graduated from Michigan in 2012, I moved to a rural Maasai village in Tanzania, which is in East Africa, because I knew I wanted to have a global health experience. So I was working at a primary school as an office manager, and I did a lot of different things, anything from hiring new teachers to creating new policies for the students to having parent meetings. I worked a lot directly with the students and their parents and the whole village. So as I was doing this, I noticed that a lot of kids would miss school, sometimes for weeks at a time. And when I started to figure out why, a lot of the reasons why kids would miss school was due to preventable health issues. For example, maybe a waterborne illness, or for girls, some of them would get pregnant at very young ages. And so I decided that I would like to study public health at the graduate level. So after a year of living and working in Tanzania, I moved back to the US, to Boston, and started working at Dana-Farber Cancer Institute as a project manager, while also applying to graduate programs in public health. And in 2014, I started to study for my Master's of Public Health at the Harvard T.H. Chan School of Public Health. I was in the Department of Global Health and Population. And while I was there, I got the opportunity to be involved with a very cool research project where I got to create and implement a evaluation study of a school health program in Lusaka, Zambia. So I got to travel to Zambia on 2 separate occasions during my master's training. And while I was there, I was working out of a clinic. And every morning when I was on my way to the office in the clinic, I would have to walk by what seemed like hundreds of sick people waiting to see the one doctor at the clinic. And as I was doing this every day, I started thinking, you know, I would really like to be able to actually treat those people, in addition to doing this research that I'm doing, which was really interesting. And that kind of got me started thinking about becoming a doctor. So after I graduated from my master's program, I started a post-bac program at Bryn Mawr College to get my pre-medical requirements out of the way. I was not pre-med at Michigan, so I had to take general chemistry, organic chemistry, biology, and physics all in 1 year. So I did that, and then after I finished that, moved back to Boston and started my current job as a clinical research coordinator, and I'm applying to medical school right now, and we'll be starting in the fall. If I could give some advice to people interested in a similar career path, I would say definitely get involved with research and get involved early. I started doing research my sophomore year. I found a great research mentor who actually got me interested in global health because the research was having to do with teenagers in the Caribbean, and also I just learned a lot of great skills from that experience. So how to do data analysis in SPSS, how to write a research paper and do a literature review. These were all things that I learned from my research experience outside of class, which I thought was incredibly useful, and also helped me to write my honors thesis, and then later on helped me to write my master's thesis too. So I've really been using those skills ever since. Another thing I would say is to really utilize the alumni network. The Michigan Alumni Network is huge, and everywhere I've gone, I've been able to meet people who have gone to Michigan, whether it's professors. I've had professors both at Harvard and at Bryn Mawr who have gone to Michigan, or doctors at the hospitals that I've worked at. I've always had doctors who went to Michigan for undergrad or medical school or both. And everybody's very proud of having gone to Michigan. But I would say definitely utilize the Alumni Association. I actually, a couple years ago, the Alumni Association matched me up with a career mentor. So I got matched up with a pediatrician around the Boston area who we met up a few times, and she told me like really great advice about becoming a doctor and being a woman in medicine. And that's been really helpful. So there's also, like, everywhere I've gone, I've always met people who've gone to Michigan. Even in Tanzania one time, I was eating at a random small restaurant and met somebody who had done his PhD at Michigan in the 70s, a Tanzanian guy, so that was crazy. But really, the alumni are everywhere. Everybody is happy to talk to a fellow Wolverine, and I'm very glad to have taken advantage of that so far and met some really interesting people that way. So I would say definitely reach out to people and use the alumni network. The best piece of career advice that I've ever received is that if there's something that you really want to do, but it's going to take a lot of work to get there, but you can't imagine yourself being happy doing anything else, you should still do it. Like I said, I was not pre-med at Michigan, never really planned on becoming a doctor, but now I'm going to be going to medical school. And when I first started thinking about becoming a doctor, it seemed like a really scary and daunting process. But one of my mentors told me, you know, if you don't think you'll be happy doing anything else, like the work it'll all pay off. So of course I'll report back in like 10 years when I'm actually a doctor, but so far I think that's been great advice. Whether it's moving across the world or taking a science class when you haven't taken one in years, I've always found it really great to just kind of go with my gut and do what I think will make me happy, even if it requires a lot of hard work. So I would say just find what you're passionate about and go for it, no matter what it takes.